Hello, my name's Dr. Alexander Berry. I'm a urologist here at Holyoke Medical Center. Today we're going to have a little brief talk about kidney stones, since they are a very common issue and a common presentation that we see not just through the emergency room, but from other people who get referred in from their primary care physicians. So just a couple of things about kidney stones. It's a pretty common medical problem. When I say that, we know that up to 20% of all men and 10% of all women will at some point during their life be affected by kidney stones. One of the things that we've noticed over the last 30 to 40 years is that the rate of kidney stones in the community has doubled. That might not sound like a lot, but when it goes from 5 or 6% up to 12% of people, that's a pretty common problem. One of the things we know is that kidney stones are more common as you head further south in the country, and they're more common as you head to the east. So the southeast of the US, down in Charlotte or North Carolina, has more stones. Having said this, even people in the Northeast are prone to getting kidney stones. Why is this a big deal? Mostly because people end up having to take a lot of time off work to get the kidney stones treated. And if you have recurrent kidney stones, you're having recurrent attacks of pain and recurrent presentations to the emergency room. One of the things we do know is that if you've had one stone, then your chances of getting another stone are fairly high. So what we tend to say to people, and one of the things that we've seen, is that once you've had a single stone, you have a 40 to 50% chance of having another stone within 5 years of that initial presentation. People often ask, what are the types of kidney stones that we see? And I'll just go through the list, and as we go through things, we'll talk about some of the things that we can do to prevent kidney stones or some of the reasons why we get certain kidney stones. But by far and away, the most common sort of kidney stone that we see is one that has calcium in it. And of those, 70% of those are what we call a calcium oxalate stone. Now, the one thing about calcium oxalate stones is there's two types. One type is a very, very hard stone. That's a calcium oxalate monohydrate stone. And then one stone is a softer stone. That's a calcium oxalate dihydrate stone. Why is that important? Well, there's certain treatments that we have for kidney stones that work better with the softer stones than with the harder stones. And that's something we'll get back to, just because that changes some of the things we might end up doing. Then there's another sort of stone that a lot of people have heard about, and that's a uric acid stone. That's the type of stone that's associated with gout and with people that eat a lot of protein. And so we saw an uptick with those stones when people had things like the South Beach diet, or people do the keto diet, or other diets that are high in protein can lead you to making uric acid stones. And then finally, there's a group of stones which are sort of inherited, but they are a very small number of stones. We think overall the tendency to make calcium stones is an inherited trait, but there are some stones like what's called a cysteine stone. And that's a particularly difficult type of stone if you happen to start making those. So people always will sort of say to us, Dr. Berry, why could I get a stone, or what are the things that we could modify if I do get stones? So let's just talk about some of the things that lead to people getting a stone. So the modifiable things, those are the things that you can change. The first one that we notice is people who have a low urine volume make stones. Now, what is it that we define as a low urine volume? That's kind of a funny sort of question. A lot of people will ask a urologist, how much should I drink each day? And this is one of those things where I'll say to someone, if you make stones, you need to be drinking enough fluid to make 1.5 liters of urine a day. So 1.5 liters is about 56 ounces. And so to make 1.5 liters at a minimum, you need to be drinking 64 ounces of fluid, 8 glasses of water. That's where that 8 glass number that you hear people throw out comes from. But it's really for people that make stones. If you don't make stones, you don't have to drink that much. So a lot of people aren't quite sure how much that might be. They sort of say, well, you know, my glass is all these different sizes. So I say to people, you know, 64 ounces, that's the same as 4 Poland Spring bottles of water. So 4 of those 16-ounce bottles. So if you wanted to sort of make sure you're drinking enough, you know, you buy yourself a 24-ounce glass, a reusable glass, or a 16-ounce reusable glass, and, you know, make sure you fill that up 3 to 4 times a day. So that's where we get that from. Then the other thing that sort of is prone to making stones when we look at people who make them is that they have a lot of calcium in their urine. And, you know, we sort of wondered for a long time, why do people get a lot of calcium in their urine? And people can get calcium in their urine for 3 sort of types of reasons. One is that their body absorbs more calcium than somebody else. A second reason is that your body starts mobilizing the calcium that's in your bones. And then the third reason, and this has always got to be part of it, is that your body's dropping or dumping more calcium into your urine. And we think that those are different genetic factors that control all of those. So we don't often go looking for exactly the reason why you have high urine in your calcium. Instead, we try to help manage that with some medications. And that's one of the reasons why it runs in families. So we'll say to somebody, do you have a family history of having kidney stones? Quite often what will happen is, for a younger person, they'll be like, I don't know anybody in my family that has stones. And then they'll end up at some family function for Thanksgiving or somebody's birthday, and all of a sudden they find out that their aunt has stones or somebody else has stones. So quite often other people in the family have had stones. It's just that the person who's seeing us in the office isn't even quite aware that that runs in their own family. So that's one of the things that we end up addressing, is this high urine calcium. It can be a problem in the longer run, because if you start making stones in your 50s, if you're female, then we worry, are you going to slowly sort of mobilize the calcium from your bones? And that can lead to weak bones and osteopenia, which are other issues that are important for bone health. Another thing that we look for is the high uric acid in your urine. And that can happen when you're having that high protein diet, when people go on that keto diet, when people are sort of doing South Beach type diet or the Atkins type diet. All of those are high protein diets, and they end up with you dropping more uric acid into your urine. And so if you want to protect yourself for that, if you're doing one of those diets, you really need to increase your fluid intake. So if you drink more water, you can flush through all of these uric acid crystals and decrease your chance of making uric acid stones. There are some certain things that protect you against stones. So when we look in people's urine, there's something known as citrate, and we measure the level of citrate in your urine. And when that level's low, you're at higher risk of getting kidney stones. Luckily, citrate can be found in a lot of dietary things. You can find it in lemon juice. So you can increase your own levels of citrate through, better intake of vegetables and some citrus. And there are occasions where we'll give people medications that are based on citrate. And when we do that, we look to increase those levels, because that can protect you against kidney stones. Then the final thing we sort of normally look at is something known as oxalate. And oxalate is found often in the diet, although there are circumstances where you can end up with more oxalate being absorbed by your body. And the classic case for that we see is somebody who's had gastric bypass surgery. So for a lot of the people who have gastric bypass surgery, the numbers are sort of in the order that 75 to 80% of them will start making stones within 2 to 3 years after their gastric bypass surgery. And the reason for that is that the actual change in their anatomy means that they have more oxalate that's being absorbed in their body. And there are a number of steps we can take to decrease that. We don't sort of normally do that for everybody that's had bypass surgery, but if you're one of those people that starts making stones, then there's things that we can do. So the picture that you can see next to me is just a single CT scan slice of somebody who's got kidney stones. Now, not everybody has kidney stones that are this bad. What you can see when you look at it is, the first thing to notice is that you can see someone's spine. And the spine is made of bone, and the bone is made of calcium, and the calcium turns up white on the CT scan. So you can see the spine sitting there in the middle of the picture. After each side, you can see a kidney. So you've got 2 kidneys, and if you can see inside those kidneys, there's a lot of that white calcium that's deposited in those kidneys. Now, in this particular circumstance, this is something called medullary sponge kidney. And I have a bunch of patients who have this, and their kidneys do look bad, and they make stones all the time. We think it's a genetic abnormality, but it's not necessarily something that's inherited, so it just appears. Now, one of the things about these people when they make their stones is if you look at that calcium in those kidneys, you can see that it's deposited in the meat of the kidney. Now, I happen to know from experience that those stones that this patient has, they're not floating around in their kidney. They're buried into the kidney itself. And this can make this difficult because what will happen is that these stones will get inflamed and this person will feel pain, but it's not necessarily because there's a stone that's moving around. So this can make things complicated if we decide to do a stone procedure or when we try to look after these people. The point of the picture is really just to show you that, look, kidneys can have lots of calcium in it, and that's an easy way for us to look to see whether you've got calcium in your kidney stones. And in this particular one, there's just a lot there. And I thought it was a good picture because then people can understand that these kidneys aren't normal. So there's different ways that we go about trying to manage somebody who's got stones. And we tend to sort of do this based on how much pain you're having and whether you've come back to the emergency room, how much discomfort you're having. And some people who pass a lot of stones, they know when something's gotten stuck. And so the thing about a stone is that if it starts out up in your kidney, it has to end up down in your bladder. And the only way for that to happen is for the stone to pass down the ureter. That's the little tube that joins the kidney down to the bladder. And you can see in this picture that we're going up into the ureter with a fancy little skinny telescope. So you can see the fancy little skinny telescope. It's called the ureteroscope. And in that blow-up view that you can see, what we've done is we've taken a special basket and we've lassoed it around the stone. And we're trying to bring the stone out with a lassoed basket. That's one way for us to get out a stone when we go up with the ureteroscope. What we typically would do is go up and we would encounter the stone, and we actually use a laser to break the stone up into small pieces. And once we've broken the stone up into small pieces, we can then bring the pieces out using those baskets, and we can try not to make any damage to the ureter as we do that. So that's one way of going after the stone. And when we do that, we have to put you to sleep, you get a general anesthetic. It takes us about an hour to do this, and then we tend to let you go home afterwards, and then we follow up. We try and find out what the stone is made of. There's another way that we tend to sort of look after stones, and that's using shock waves. So it's a fancy machine, and we bring the machine into the operating room, and we tend to give you some sedation. So we make you so that you're relaxed, but it's not a general anesthetic. And then we put the machine on your side where you've got the stones, and we fire shock waves at the stone. So in this picture, you can see the shock waves being fired at the stone. And when we fire the shock waves at the stone, what we hope happens is that we break the stone into little pieces. We make it into beach sand, coarse sand, and hopefully that's what you're going to pass. Now, this is important because depending on how hard the stone is, depends on how easy or how hard it is to break it up with the shock waves. So if you remember before, we talked about having these calcium stones that you might make. And we talked about the calcium oxalate monohydrate stones, which are very hard, and the calcium oxalate dihydrate stones, which are softer. So in this sort of circumstance, the calcium oxalate, the hard stones, they don't do as well when we hit them with a shock wave. So instead of being 85% successful, we might only be 70% or 60% successful with a shock wave. So there are times when we have to do this sort of procedure a couple of times to break up the stones into small enough pieces for them to pass. Then the other really important thing is that after you get any of these sort of procedures, you need to really increase your fluid intake. Because what you want to do is you want to kind of flush these all out of your system. So that's what happens when we get a kidney stone. That's kind of what a kidney stone looks like. And those are the things that we might do if you turn up in the hospital with enough pain that we have to operate for the kidney stones. But what becomes very important in the longer run is trying to make sure that you don't make new stones. So we talked about that a little bit before, but we'll just go over some of those things that are very important for you to remember. The first thing to remember is you've got to make sure you're taking enough fluid. One of the things that happens, and we said about this, that the minimum you need to take in would be 64 ounces a day, 2 liters, 4 Poland Spring bottles of water. But you might say, hey, Dr. Berry, I work outside, I'm in the sun all the time, and I have patients who are roofers, and they're sweating a lot. For them, they end up having to drink a gallon of water a day. So you may have to drink more because the real aim is not how much you drink, but how much you urinate. So they're trying to make their 1.5 liters of urine to have nice, clear, yellow urine, not concentrated urine. But to do that, they've got to drink a lot. So we always say to people, you have to adjust how much you drink based on how much you're going to urinate and on your activity levels. So that's very important. The other thing that we know is that a lot of people keep on seeming to wait till later in the day to drink their fluid. So I'll see somebody and they'll be like, well, I think I drink enough. And then you talk to them and they say, well, I have a coffee in the morning. Coffee is fine as long as you have 1 or 2 cups, not more than that. But they'll have a coffee in the morning and then they don't drink anything till after lunch, and then they're trying to drink all their water between 1 o'clock and 6 o'clock. That doesn't help. If you make stones, you really have to drink more fluid in the morning. So I'll say to people, hey, you need to drink 16 to 32 ounces before 9 o'clock in the morning, before you leave the house. You got a tank up and then you can just sort of glide through the day. So that's one of the important things. Then the other thing that we sort of tell people is watch out for the salt in your diet. Why is this important? Well, we're based on little creatures that climbed out of the sea. And so your blood tastes salty because what we really are walking bags of salt water. So your blood's going to try and scavenge salt all the day. So if you eat salt and then your body tries to get rid of the salt, it switches out for salt in the urine. It pulls the salt back in and it dumps calcium out, and that's what makes you make more stones. So if you minimize the amount of salt, then you're going to end up able to reduce your chance of making kidney stones. And everybody will say, hey, but I don't put lots of salt on my food. And the answer really there is that, unfortunately, when somebody gives you food across a counter, or you go to a restaurant, or you open a cardboard box to eat a cookie, that's where the salt is. So salt hides, I say, in cardboard boxes and when you eat out. And so you have to be very careful about that. And that's where I tell people to really watch their salt. The other thing that we end up talking about is watching out for the oxalate in their diet. And a lot of people, they'll go online and they'll come back to me and say, Dr. Berry, it says that I can't eat green leafy vegetables. I'm like, well, it says you should really sort of just watch how much you eat. And the big things that have oxalate that we tell people, the easy things to work on, are potatoes and nuts. And by potatoes, I mean potatoes, French fries, and potato chips. And when I say to somebody about French fries, I'll say to them, look, all you can have at a time is how much you can get in a McDonald's Happy Meal in the little tiny paper bag. You're not allowed the cardboard box filled with French fries, just a little paper bag. You can have that much. Like a medium potato or small potato. That's the most you can have at a time. And when we're talking about nuts, we're talking about almonds, cashews, peanuts, and you can have sunflower seeds. You're allowed to eat seeds, but the nuts are a problem. I've had lots of different patients. One who was like, well, I thought I was trying to be good with my almond milk. Like, no, almond milk's a horrible thing to have. It's really not good if you're a stone maker. And so, we'll try to also then help people make sure they have more citrate in their diet, which protects them from kidney stones. And how do you do that? The easiest thing is lemon juice. So it turns out an ounce of lemon juice has enough citrate to help protect you each day. And you can sort of do that any one of a number of ways. I have people who use, they get the squeeze bottle of the lemon and they put some of that in the water that they drink. I've got patients who, I don't know how they do this, but they just will do a shot of 1 ounce of lemon juice each day, but that works for them. And then we have other people who might add some lemonade powder. Particularly, there's a product called True Lemon that you can get at the supermarket, and they'll add that to their water. And so that's really a way that we try to prevent people from getting recurrent calcium stones, as we talked about. Then the other sort of stone that we'll try to help them prevent are those uric acid stones. And we talked about that the main way you get uric acid is through these high protein type diets. And so the way to sort of help around those is plenty of fluid. So you need to be drinking that 2 to 2.5 liters a day if you're going on any form of high protein diet. Then the other thing that we might do with those patients is we sometimes add medications. And there's a couple of different medications. I won't go into them here, but there are different ways to address uric acid stones. So this summer, when it's coming up and you're out and you're about, please, please keep up your fluid intake. It's important for managing kidney stones and for lots of other medical issues.